you guys probably know me by Elizabeth Arlano, because I'll answer flags. I'm in charge entry. So I'm in the coding, this is more of the coding aspect, because there seems to be confusion even for us. There was some confusion between the IPPE, annual wellness visits, and routine physicals. So the IPPE, the initial Welcome to Medicare physical, it is a covered benefit within the first, that should be 12 months. Apparently my fixed copy did not get in here. It's within the first 12 months of their eligibility to Medicare. However, if they have this done somewhere else, Medicare is only going to pay it once. And so if they get it done at their gynecologist's office, if they get it done at another specialist's office and we bill for it, we're not going to get paid for it because it's already been done.
And just to clarify, patients could become eligible for Part A when they hit 65 and not purchase their Part B benefits. So there may be different dates. So it's 12 months for Part B.
Oh,
benefits.
it is? Okay.
Yes, it is. Because it is a Part B service.
You guys are going to become insurance experts.
So the IPPE covers a review of their medical history, their medications they're currently taking, their social family history, risk for falls, depression, a physical examination, an EKG if it's necessary, and then a plan for their future preventative care. An annual wellness visit. This is covered by Medicare every calendar year, so if they come in on day 364, it's not going to get paid for. It has to have been 365 days from the prior visit. It is a review of their medicines, the risk for falls and depressions, a plan for future visits, and it is not an exam. It is not a physical. It is nothing of that is included. And there's no ADN required for this because this is the preventative care that Medicare does cover. Now, physicians, if they choose to do a physical along with this annual wellness visit and only bill for the annual wellness visit, that is okay, but these items have to be documented in the chart for us to bill out an annual wellness visit. We can't do a physical and bill an annual wellness visit instead. So the routine physical, never covered, no ADN required. Our Medicare patients can choose to pay for simple care rates. The labs associated with them are also never covered. And I have a why they don't pay because I'm pretty sure you're going to have some patients wanting to know why. In the age ranges for patients between like 20 and 40, they're more likely to have only come in once a year for their physical. Our patients who are 60, 65 and older, they're more likely to be coming in for sick visits or managing their diabetes or their thyroid or their hypertension. So Medicare doesn't want to pay for a physical when you're going to already be checking that theoretically throughout the year. They cover the annual wellness visit where they can arrange to come back and if they have concerning labs or if they have conditions that they need to have watched, then they can make a follow-up appointment or be referred out to other specialists. Immunizations. So for Medicare, they will cover hepatitis B if the patient is to medium to high risk. They will cover the flu shot once per calendar year. The pneumonia, once their entire Medicare coverage. That's it. And the Tdap, if they step on a rusty nail, yes, they're going to pay for it. If they stepped on a rusty nail last year and they got a Tdap last year, they're not going to pay for it this year. They're going to pay for it from 5 years from their last one. If they got bit by a dog, that is also is not medically necessary for a Tdap.
But for that one, you have to have an ABN for the administration.
Yes.
They won't pay for you to administer it, but they will pay for the vaccine if they think it's medically necessary.
So here is the resource that we use, a website you can go to find all of the lists of diagnosis codes if you're interested in finding out. It is a very, very large document. And it goes through everything and all services. Also, if you have any questions, you're perfectly fine to contact Tamara and I. I have our extension numbers. If you have any other questions
Or email,
or
however,
whatever works.
Send something in our office, however you want to do it.
Any questions while you have the experts here?
I have one.
Yes.
The physical waivers that we have patients sign that come in for the routine physicals, if they come in for their wellness exam, do they still sign that?
They don't need to sign any physical waiver for Medicare at all.
We're going to probably get rid of most of that anyway, but they don't need to sign a waiver for a physical. Medicare patients do not need to.
It's never covered.
Yes.
Why are we calling people patients?
That's a very good question, and we are looking at that.
It is. Well, and the other thing about it is that a lot of Medicare patients don't understand that they have coverage for an annual wellness visit and not a physical exam.
Right.
Because Medicare is saying that they pay for preventative care, and they do, but not what is the normal thought of
This is
idea
a whole
of preventative care.
mindset change, and the reason that we're sharing this with you is because your part is going to be patient education, okay, and provider education, because even last evening we were working with some of the providers and they didn't know this. So, you know, this is a change, and we're all learning it, and we're passing that knowledge on to you, and we'll be passing it on to the providers, but you will also be, your providers are going to say, but I can do that, and you're going to have to say, no, you can't. And there's certain criteria for both an annual wellness exam and a subsequent one. So you actually get, they have different codes.
You have the original annual wellness visit, which comes after the Welcome to Medicare physical, and then every year on from that, we would use a subsequent annual wellness visit.
Right, we're going to look at, go ahead.
Gina's going to say that.
Well, just making sure. We are looking at changing the allocation, so it won't just be a 30-minute physical or 15-minute physical. It'll say an AWV or an IPPE. It'll be specific, which will be very, very helpful for, you know, the people scheduling and the people rooming and checking in. There are a couple of different forms also that we're going to incorporate. Right now the EMR has the Welcome to Medicare physical information, but we're going to also make a new template for the annual wellness visit. So some of the paperwork that a couple of providers are currently using is going to start kind of shuffling through the clinics, and a lot of what's on this paper here, these papers, will be in the template so that you can just, kind of like the pre-appointment questionnaires, just take that information and put it into the computer. So we're working on a bunch of stuff to make this a lot easier because it's a lot of information. Okay, we're working on it.
Okay?
And if at any time you have any questions, feel free.
Okay.
I would rather you question it and get a definite answer than to guess.
Okay. Any other questions before we
Release them.
No? Okay. All right.